This video lecture is going to talk about endocrine glands found in the pelvic area. We're looking down at the gonads. First set of glands we're going to take a look at are the testes. And so the male reproductive glands are going to primarily produce testosterone. Testosterone is an androgen. This has a masculinizing effect. It enhances male physical characteristics. It's going to have an impact upon sperm production, but we're looking at what we'd see signs and symptoms of our patient coming in if, as far as their, muscle structure, their skeletal structure, body hair, scalp hair, those kind of things. A hypersecretion of testosterone is going to cause hirsutism. That was that short, muscular, hairy physique. And so we're going to see the Robin Williams physique, the stocky, very hairy wrestler. A hyposecretion, a lack of testosterone, will result in eunuchism. Now, this is during puberty. And so during puberty, if he does not produce enough testosterone, he's not going to develop his secondary sexual characteristics. He's going to look like a boy, not a man. As an older individual, as testosterone levels start to drop, we may start to see a loss of body hair. We may see a loss of facial or scalp hair. We may see a loss of skeletal muscle. And so Ewoks, I think, are just the hysterical representation of that hirsutism when you want to think of short, hairy, stocky. I want to clarify surgical procedures on male organs and whether they do or do not impact hormone level, because I see this misconception with my students all the time. So make sure you keep this straight. Castration is removal of the testes. And so it gets rid of the gland producing structures, which would impact testosterone levels. They would drop testosterone levels considerably. You would see all of those repercussions. Vasectomy is blocking the vas deferens, so sperm cannot reach the semen packet. That's for birth control. This has no impact on the blood flow to the testes or glandular production of hormones. And so a male who's had vasectomy will have no testosterone changes. So if your patient has undergone a vasectomy and they later talk about how they're worried that they have less testosterone and it's impacting everything, that's not anything to do with the vasectomy itself. So make sure you keep that straight. All right, the ovaries, the female reproductive glands, these produce eggs. During ovulation, that little follicle then grows into a large glandular structure called a corpus luteum. This is going to produce large amounts of hormones such as progesterone. Progesterone has a feminizing effect, enhances female secondary sex characteristics. It's going to, during puberty, enhance breast development, hip development. It's going to produce female pheromones, the natural body musk that is produced. It's also going to stimulate endometrial development. She's going to stimulate the glandular tissue of the uterus, which is going to grow a lot more of the hormone producing tissue. If she has an overproduction of progesterone, this is going to cause endometriosis. It's going to overgrow the glandular tissue in the uterus, which may squeeze out in the peritoneal space, and oversecretion of those hormones, which is going to cause a lot of metabolic imbalances. If she has a hyposecretion of the progesterone, so let's say we had to get rid of the ovaries because of ovarian cancer when she was in puberty stage. This is going to result in eunuchism. She'll have underdeveloped secondary characteristics. She may not develop breasts. She may not develop the large hips. And so this is something that happens earlier in age. Later in age, if she loses the progesterone levels, she may have a regression of some of those secondary characteristics. Ovaries also produce estrogen. Estrogen do enhance female characteristics, but they're more impactful upon bone tissue formation. They stimulate moving calcium from blood into bone, stimulating bone tissue density, and that drawing of the calcium out of the blood also helps to protect against arteriosclerosis. Estrogen also goes into the uterus and it stimulates blood flow to the endometrium, helping to grow the endometrial from the vascular perspective. Progesterone was glandular, estrogen is vascular. That's where hypersecretion will also cause endometriosis by overgrowing the uterine tissue, but not so much overgrowing the glandular tissue. And so we'll have this tissue go out into the peritoneal space, but it may not have as much metabolic imbalance as a hypersecretion of progesterone. Hyposecretion, if it's early in life, it'll result in eunuchism. Again, it'll have a hard time developing breast and hip development in the adolescent girl. As we get older and when we hit menopause, that reduction, reduction estrogen will send us into menopause, where we'll start to have a lot of shutdown of hormone function in the hypothalamus and pituitary. This will cause a lot of mood, appetite, behavioral changes, body temperature, blood pressure changes. And because we're no longer protecting bone tissue by keeping density, we may lose some bone density issues and we may see a flare-up of osteoporosis. So there's differences between estrogen and progesterone. Make sure you know the differences. Now again, surgical. Let's talk distinctions here. An ovarectomy is removal of the ovaries. Again, say for example, if we have ovarian cancer. If we do that, yes, we are going to drop the progesterone estrogen levels. We will send you into early menopause. A hysterectomy is removal of the uterus. If you do a limited hysterectomy, that's just the uterus, you're leaving the ovaries behind, hormone levels are normal. If you do a radical hysterectomy, that's taking the uterus and the ovaries. And so now you obviously will impact hormone levels. So if you do a hysterectomy, bear in mind if it's a limited hysterectomy or a radical. Tubal ligation is occluding the fallopian tubes. And so if she gets her tubes tied for birth control, that's going to stop egg and sperm from meeting each other. That has no impact on the ovaries. Hormone levels are normal. So make sure you understand the distinction between these major surgical procedures and if they do or do not impact estrogen progesterone levels. All right, those are the pelvic glands. That talks about the major hormones produced from each. Make sure you understand the distinctions. All right, we've gone through the major hormones of the entire endocrine system, pathologically speaking. I want to take just a moment to talk about normal age-related changes. Not pathological, normal. I want you to review the material in the chapter and be able to tell me, if your patient goes through puberty growth, what are the major hormones that impact puberty, starting it up and shutting it down? There are hormone changes that affect us as we get older that change our metabolic rate. Know which of the hormones are and how they function. Kidney water retention, blood glucose levels, sexual characteristics. Be able to describe the hormones that make these changes in normal growth and aging. As it recommends down there, these would be awesome essay questions for your quiz and exam. So this is a good thing to review. All right, that takes us through the chapter. Take your time. Study cards are an excellent tool for this chapter to help you organize your material. Good luck.